All right, hi guys, welcome to Coats and Stilettos. So today I'm going to do something kind of different. Today's video, I just wanted to give some insight about one of the most talked about topics in the media right now and in all of society, the coronavirus. And I think it's a very important thing to shed some light on, because there is a lot that people don't know about what's going on in the hospital and how some of these healthcare workers are dealing with the situation. So what I did is ask some of my friends from different specialties around the United States to come in and talk about their experience and what it's been like so far for them. So, without further ado, let's get to the video. Oh, first of all, let me introduce everyone to everyone, because some of y'all don't know who each other are. Okay, everyone knows who I am. Okay, so we can start with Rana. You can introduce yourself.
Hi, everybody. My name's Rana. It's like Hannah, but with an R. I am a first-year intern at UT Southwestern in Dallas. I'm actually doing radiology, but spending 1 year in internal medicine. So Kristeen and I work together.
Thanks. I guess the light is on me.
Yeah.
So, I'm Janas. I'm an intern doing emergency medicine in Brooklyn, New York, the epicenter of this whole coronavirus pandemic. And yeah.
I'm Suzette. I am also an intern in emergency medicine at New Haven Hospital here in New Haven, Connecticut, on the periphery of this epidemic. So,
okay, and I am Kristeen. I am an internal medicine physician, resident, first year resident as well, in Dallas. And so most of you who are familiar with my channel, this is Coats and Stilettos, and I wanted to do something different this time around. Given the current situation that we find ourselves in, a lot of people have questions about what's going on in the hospital, how are residents coping, and I kind of feel like a lot of people don't really understand the severity of what's going on right now, because a lot of the times it's like if you can't see it, it's not as important for you, or it's not that it's possibly just not real for you. But for us, given that we are at the center of it, some more than others, we see how, severe it is. We see how important it is for a lot of us to actually take this seriously. And I just wanted to take the time out for everyone to just kind of talk about their experience, what it's been like for them during this time period, and, how have they been coping. So we can just open the floor to talk about, I guess, the very first time you heard about Corona. Like, what were your thoughts? So I guess I'll start it off. Like the very first time I heard it, I think it was sometime in December. One of my friends was like, "Hey, have you heard about this coronavirus thing going on in China?" And the first thing I said to her was like, "Girl, coronavirus, I'm thinking about Sketchy Micro." I'm like, right. Sketchy Micro only had like 2 minutes about Corona.
10 seconds.
Right? I was like, Sketchy Micro didn't make it a big deal. So in my head, I was just like, girl, the first thing I told her was like, common cold, leave me alone, And I went on about my day. But slowly, I just kept hearing more and more about it. But even in the beginning, I still didn't take the time out to actually do research and figure out exactly what was going on.
Okay, for me, when I first heard, I didn't hear about it till February, actually. I didn't take it seriously at all. Like, I was very ignorant about it. And then our first case, I remember at my hospital, it was maybe like, I want to say second week of March. It was like a guy tested positive. And then, so we had like 3 influx of patients. The first wave was just like the people who were freaking out, like, oh, coronavirus in New York, coronavirus in New York. And, as the ER doctor, you're already annoyed with all of the BS that comes into the ER. Like, so this is just like added to more of the BS that comes into the ER, like people having no symptoms, like, oh, I know a friend of a friend of a friend who tested positive, and I was around that friend for like 30 seconds. I think I might have it. You deal with that annoyance at first, and that just adds to your stress level because you're trying to calm people down. And then, within a week, like I would say like this was like the second week of March, within a week, my life completely changed. Like, I'm talking, not only were we getting the people who were freaking out, we started seeing the really sick people, and the volume in the ED just like tripled within a week. And I was exhausted. I remember I was working night shifts whenever all this was happening. And I don't know, I completely just just underestimated this whole virus. I thought it was like, oh, this is just like a little baby flu. Like, why y'all tripping? So yeah.
I think that was very similar to my experience and what my experience has been so far. Kind of early on in the year, it wasn't really something that was, at the forefront of our minds. You heard about it here and there, kind of like one of those sensationalized media things where you're just like, oh goodness, here's another thing that nobody knows what they're talking about and they're just kind of saying whatever. And I think it didn't really take patience for me to start to see the switch. But once we started hearing the reports out of Italy, especially, I think that's what kind of triggered, my anxiety and a lot of my co-residents' anxiety around it. So the push actually came from the residents first, where it was like, we shouldn't be having conference. We can't let everybody in the department get sick at the same time. We have to make these changes. And then kind of exponentially, just like Janas said, things changed very quickly, where all of a sudden, where some of our administrators might have been kind of downplaying it a little bit, like, oh, this is the flu, this is the common cold, we're going to treat it the same way. It switched very quickly to be something that we needed to aggressively get out ahead of.
I think my story is more similar to Kristine's. My parents watched the news, and I remember I was on a call with them, and my dad was like, what is this coronavirus thing? And I was like, oh, it's just, it's a common cold. I'd never heard anything other than that. I actually remember specifically going to my first aid book, which is, if y'all don't know, y'all know, but the people watching don't know, is the book that you use to study for the board exams. And it has literally one line on coronavirus. It's not even, it's sandwiched in a table of probably 20 other viruses. So I said, yeah, it's a widely known virus that gives you the common cold. That's what it is. And then, as y'all said, then things started escalating, not only in other countries, but in our own hospitals. And then eventually you have no choice but to pick up on the severity of it.
Mm-hmm. Yeah, I just remembered things literally changed in a weekend. Prior to, like, I think I was off. I was on nights and then I was off for 2 days. And then literally like a snap of the finger, things changed. Before where, PPE was literally at your disposal. The 2 days later, it was just like, where are the masks? Like, where are things? Like, what's going on? And I think some of the skepticism coming from, like, I guess, society, the media, a lot of the things have become political when really it shouldn't. But it's like people say, like, where did all the PPE go? Like, why did it just disappear? And it's like, what people don't understand is that you don't use, PPE for every single patient. And we have anywhere between, like, these numbers might not be correct, but like 30,000, new patients admitted to the hospital, a month or so, but all of them don't need, strict PPE. But now, given the situation where there are patients who can be asymptomatic, you don't know if they have it or not, you need to wear PPE for every single patient that walks into the hospital. And so therefore you run through more PPE at a faster rate than you usually would on a normal day. So instead of using just maybe 1 or 2 masks a shift, now you're using close to 50 a shift because, we have to protect ourselves too as well.
Yeah.
I think another thing that people probably don't understand is, I saw a meme recently that said, this is what normal people think work in the hospital, and it's doctors and nurses, but there's respiratory therapists, physical therapists, social work, there's people coming in and out of the room constantly. And it's not just the nurses and the physicians and all those people now, everyone needs PPE. If the doctor needs it, everyone else needs it too. And so you go through a lot more than what people are seeing or what people are thinking, I think.
Yeah. Yeah, I think like the unsung heroes are like the social workers, because there's a lot that they do that, I wouldn't be able to coordinate, especially during these times where you're so busy with patient care. You have no time for like the social aspect of everything.
Yeah,
I agree.
So regarding like your workload, has your workload changed? Is it a lot more? Is it a lot less? What's it like at work now?
So I'll speak from the ER perspective. Like, initially we had like just crazy volume because you had like the normal ER stuff coming in, then you had like the people from COVID freaking out coming in, then you had the sick COVID people coming in, and then eventually the people who were coming to the ER for BS, they realized like, oh shoot, this is not a real emergency. So then you get like the really sick people coming in. So as an ER intern, I've turned into an intensivist somehow, because our entire ER has been pretty much turned into an ICU, and basically a barely functioning ICU, because you have beds, stretchers in the hallways without monitors, and stretchers in front of stretchers. So the volume of sick people has increased. As of this very moment, like today, April 13th, I would say we're kind of seeing a decrease in the volume. So hopefully that's a good sign. But this time last week, it was still pretty crazy in terms of like the volume of really sick people coming in.
Echoing what you're saying almost verbatim, we So this interesting thing happened, like you said, where people really started to think, what was an emergency? What was I really going to come into the emergency room for? So we saw kind of like this really eerie dip in our volume where we just weren't having the same number of patients, which made sense. But the acuity of our patients was much, much more severe because people were coming in at the extremes of their illness, where people who had an exacerbation of their congestive heart failure would have come in earlier. They're kind of like, oh no, I'm not going to get that coronavirus. Figure it out and see what I can do on my own at home. So you're seeing people come in a lot more ill, in addition to the people that are coming for kind of like the coronavirus symptoms. So that part has been interesting. And now I've transitioned to like, I'm on vacation at this moment. So I'm kind of really nervous to see what's going to be the case when I get back, because all I'm getting are the stories kind of from our group chats and all that about what people are dealing with on a day-to-day basis now.
Yeah. What about you, Rana?
I would say, so a couple of things, I guess, for me is we did see that kind of eerie drop in the patient load in the hospital, kind of like what both of y'all were saying, that the people who were kind of mildly sick probably knew to stay at home and stay away from the chaos. But then once you did, when you were admitting patients, they were really quite sick, but there weren't as many of them. That's true. And for me, actually, this might be a little unique, is I have a pre-existing condition. So they took me off of actually working with patients. So speaking directly about my workload, it's been a little unique in that I'm working from home and actually making home phone calls to families because hospitals don't allow visitors anymore. So I keep track of some COVID, some non-COVID, but mostly ICU patients who are frequently on ventilators, and call their families and kind of let them know what's going on. And I've also noticed that the load in the ICU is a little smaller than it usually is right now. So that's been my experience.
Yeah. So for me, kind of the same as Rana, but not because I have a pre-existing condition. Is that what ended up happening is that a lot of our subspecialties, like our hybrids, they kind of canceled those in a way, and kind of made new rotations. So those rotations to help the hospitalists who are taking care of the COVID patients, because the load of COVID patients aren't as significant or extensive as it is in like New York, California, New Orleans, the residents now have not needed to take care of any of the COVID patients. So most of us haven't had the chance to take care of any of the patients.
Lucky.
Yeah.
Wow.
So
unless it's from home. Yeah.
Yeah. So the only level of care that I have had of a COVID patient is through chart checking. So the load isn't as extensive that we need all hands on deck just yet. And that's something that we've kind of been preparing for, but it's never gotten to that point. So what they've done is kind of had all of those residents who have been on these hybrids where like neurology, they also are seeing less of a patient load because a lot of the patients aren't coming in that are mildly sick or whatever. So they only needed one fellow on that, and therefore they didn't need extra hands. So all of those residents were told just to stay home and do things like home calls to patients' families. And also to kind of quarantine yourself. And we're all on backup because although we are not technically taking care of any of the COVID patients, because we're in the hospital, you're still susceptible to getting the infection period. And so in that event, if a patient or if the resident does contract the virus, there is a list of residents who are on backup call that can be switched immediately. So all of us are practically on backup, but those residents who are on the ICU, who are on the wards, they are still there. Those are like, the ones that can't, obviously take time out, like at home to quarantine themselves. But we do have separate, like ICU, separate wards that the hospitalists themselves are covering, while other patients who aren't COVID are being covered by the residents. So that's how our hospital has kind of been set up, and the workload has been, has been less than normal because a lot of patients aren't coming in. But what scares me is that at that point we will have a surge in patients who aren't COVID patients, but who are patients with these existing conditions that have like kind of allowed their sickness or the disease to kind of fester a little bit until it gets to a point where they need admission to the hospital. So in my mind, I'm thinking, at what point will that happen? At what point will that surge of patients happen? And I think that's the surge we are personally waiting for.
Yeah.
All right, guys, thanks for watching.